Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to share the COVID-19 pandemic update with data accurate through July 15th, 2021. This week, I'll ask the same question I usually ask, and that is, how's the pandemic progressing globally in the United States and in our region? And I'll update what we've talked about several times before, which is what should I know now about the Delta variant. Globally, we've seen over 4 million deaths, 1.4% increase in the past week. As I pointed out, this is now the 12th most lethal pandemic in recorded history. 1.4% is the third week in a row it's been below 1.5%. That's good, but that still means over 100,000 deaths worldwide in the last 2 weeks, 5.5 deaths every minute. So while we may think of this pandemic as having slowed down or going away, it simply hasn't. Of particular concern, if you look at this chart, you'll see that there was a spike back in March and April that we've talked about many times, and then a big surge in daily deaths in the wintertime, then again in the spring, and then it's been coming down. But now we're watching with some concern now a couple of weeks of increasing number of daily deaths. And again, reminding us that this number of deaths is still greater than it was any time between March and October of last year. So the pandemic may be slowing down, but it also looks like it may be picking steam up again. Again, historically, the pandemic began in East Asia and China. Then it exploded in Europe in the spring, followed by an explosion in the Americas. The first big spike was a combination of the Americas, including the United States and Europe. The second big spike is more evenly distributed between the Americas, Europe, and South Asia. In the last couple of weeks, we've been watching this resurgence in South Asia and the Americas. Of the countries in the world where there have been over 1,500 deaths per million, this is a way of assessing how impactful the pandemic is at the national level. There's 23 countries, and there's the U.S. at number 16. The U.S. has now had over 620,000 deaths, making it the third leading cause of death in the past year. 0.3% week-to-week increase, which is good. This is now, I guess, several months that we've had below a 1% increase, which is good to see. But again, even with that, that's 1,800 deaths last week, which is slightly more deaths than the week before. And that's 258 deaths a day, or 10.5 deaths every hour. And the reason I go into so much detail with the number of deaths is because sometimes people look at this and say, well, relatively, it's much slower growing than it was a year ago. And that's true. And I'm glad to see that. But it's not gone away. If you look at the daily number of deaths, we watched this. We had the spike back in the spring, just like the world did. We had a little bit of a hump in the summertime, a single spike in the winter, and then been coming down pretty consistently until possibly lately. Again, as I mentioned, more deaths last week than the week before. We'll keep our eye on that. But again, the number is much more reassuring than it has been for a long time. In terms of our region, that's where the U.S. is. Tennessee, in terms of deaths per million, is just about at the national average, just a few points below. The states that surround us, 4 of them are higher than us. They tend to be the ones with athletic teams that were red, and the 4 of them are below us. The highest ranked state in terms of deaths per million is New Jersey. The point of this is simply to say that right now our fate is pretty much the same as the U.S. nationwide. But we've been watching with a little bit of concern. This is Tennessee now specifically. We had this spike in cases. It's been coming down, but you can see in the last couple of weeks, definitely an increase in the number of cases. I've always been hesitant to use cases because it depends on how much we test. But if you look at deaths, again, coming down pretty nicely, whether this little spike here is going to be continuous or not is something we'll have to keep an eye on. But I think we can say right now the pandemic is not over in our region. It's not over in our country. It has slowed down, thanks in large part to the number of people getting vaccinated. But that raises the question of the Delta variant, which we've talked about before. It has different names. Again, it was first detected in India. It's probably about 50% more transmissible, more easy to spread than the Alpha variant, which was itself 50% more transmissible than the original virus. It's been reported in over 100 countries worldwide. It accounts for 97, virtually all of the new cases in England, and over half of cases in the United States, and it's been identified in all 50 states. Remember this simple point: the virus comes into the body, it spreads, and throughout the body it grows, and it changes and it mutates. And what comes out of the body may be slightly different. As I said before, we don't really care whether a virus is different unless it makes a difference in its transmissibility, how easy it is to spread, its lethality, how serious it is, or its susceptibility, whether it can evade our immune system. In terms of the Delta variant, this seems pretty confident that this is definitely more transmissible, which explains why it's now accounting for such a large number of cases in the US and elsewhere. In terms of its lethality, it's a little bit hard, perhaps it's a little too early to say. Early on, we were thinking it was more lethal. It may be, but it's a little bit hard to say because it's now affecting a different population, generally a younger population, because most of the older folks have been vaccinated or have had the disease. If you look in England, you see this really sharp increase in the number of cases starting in early June and coming on. It's the second biggest spike in cases that they've had. But if you look at deaths, the death spike is not there yet. There is an increase, no doubt. We'll have to wait and see. Now, this doesn't mean that the Delta variant is not as lethal as the previous variants. What it could mean is it's affecting a different population. As I say, it could be affecting young people because older folks are vaccinated or have already had the disease. And young folks typically don't die from COVID. Some do, but typically it's less common. So we'll have to keep an eye on this to know whether or not it's more lethal. In terms of susceptibility, the preliminary data look like it may be slightly, the vaccines may be slightly less effective against the Delta variant. But overwhelmingly, people that are getting sick now from the Delta variant, people are getting hospitalized, overwhelmingly are folks who have not been vaccinated. So again, it poses a serious risk for individuals and in regions where there has been lower rates of vaccination. Now, I've shown you this before, but I'm going to show it again because sometimes people think that herd immunity is going to protect everyone everywhere. And that's not necessarily true. The whole idea of herd immunity, of course, is in a natural population where no one's immune, a disease arrives, it affects a few people and they spread it and they spread it and they spread it until the disease is widespread. Now you take that same 100 people and you vaccinate 75% of them. Now the disease arrives, a few people get infected, but there's very little secondary spread. That means most of the people are, even those who aren't immune, are protected. That's what we call herd immunity. But what if you take the same 100 people and you vaccinate 75% of them, but now you see there's a cluster, a geographic cluster, like we have in the Southeast, like we have in the state of Tennessee, of people who are not vaccinated. Well, when the disease hits or a new variant hits, it is going to spread. So even if you reach a level where herd immunity might be possible societal wide, there may well be pockets, either defined by geography or social conditions or something else, where people are going to be vulnerable. All right. So the bottom line is, as long as SARS continues to spread around the world, especially in unvaccinated populations, it will absolutely continue to mutate. And future mutations may vary in transmissibility, lethality, and susceptibility, which they may become less, which would be great, but they may also be greater, including posing a greater risk even for those who've been vaccinated. Therefore, everyone needs to get vaccinated, both in our country and around the world. That's the bottom line of the Delta variant. If we had widespread vaccination, most people believe that this variant would be under control. There's a great deal more information about COVID-19 on the College of Public Health website. If you're sharing these emails with anyone, these videos, please let them know that they can be added directly to our mailing list, and they'll get a weekly update. As always, I'd like to thank Dara Young for editing, producing, and posting these videos. If you have any questions, whether it's about the Delta variant or anything else, please let me know. I look forward to hearing from you, and I'll do my very best to answer your question. Thanks a lot. And until next week, please be well.